Good morning. My name is Kathryn, and I'm studying to be a nurse practitioner. I'm glad you came in to see me today. Can you tell me your full name?
Robert Grant Giat.
What do you go by?
Grant.
Grant. Can you tell me your date of birth?
February 16th, 2008.
And how old are you?
15.
And you're about to be 16?
Yeah.
Okay. Can you tell me who brought you in today?
My aunt.
Your aunt? Okay. Was she worried about you or you wanted to come in?
I just wanted to come in to check out.
Okay. So why did you decide to come see me today?
Because I've had issues with anxiety and like depression type stuff.
Okay. So how long have these anxious feelings been going on?
For around like 4 weeks or up to 6 weeks now.
4 weeks straight? No.
Yeah, I just kind of.
Like just in the past 4 weeks?
It's kind of been off and on, like sort of feeling.
And I just wanted to let you know that I talked to your aunt to get consent about videoing this and showing on social media as a learning tool. Are you okay with that?
Yeah.
Okay, good. So you say about 4 to 6 weeks these anxiety feelings have been going on and depression. How severe do you feel these anxiety and depression feelings are?
It can be in spikes, kind of like sometimes it can be a little worse. I wouldn't say it would be ever too bad, but it comes and goes.
Okay. Is there anything that makes it worse?
Whenever I feel alone or it's like something's going wrong, like with school.
Okay. We're going to get to school in a minute, okay? Is there anything that makes it better?
Whenever I'm with my friends or with a bunch of people that I enjoy being with.
Okay. How do you feel when you're not anxious?
I feel calm and collective and I'll get my stuff done.
Okay.
And not angry or any of that.
When is the last time you felt some anxiety?
I feel it just coming in here, talking to a new person.
Okay, that's understandable. Would you say your mood changes when you're anxious?
Yes.
In what way?
I can be mad, I can be like I don't even know what you call it, but something whenever you feel kind of like you want to laugh but can't stop type feeling. I can be sad, it can just be anything really.
So you say your mood's kind of all over the place.
Yeah.
When this happens, okay. Have you ever experienced a panic attack, or do you know what that is?
I think I've experienced some panic attacks whenever my body just feels like something's going on with it that's really not happening.
Okay, so like describe to me the symptoms. Like, do you feel like you're gonna pass out? Do you get double vision?
I kind of feel like I'm getting dizzy or lightheaded, and I kind of feel like I get shortness of breath type feeling, and I'll get passed out type feeling until I calm myself down and realize that the situation is not what it is.
Okay, so you're able to calm yourself down. That's good. What other symptoms of anxiety do you have when this occurs? You get sweaty palms, or
I get sweaty palms. I start sweating or profusely, like tapping my like feet or trying to do something that just sets my mind away from it.
okay. How are you sleeping?
I wouldn't say too good. My sleep schedule is kind of not great because of anxiety of what's going to happen the next day or what's going to happen in my future.
Okay, so how many hours of sleep do you think you get each night?
It can be from 6 to 0.
6 to 0. I like that you're loving on my dog, Lola, here. Okay, so what time do you think you go to bed?
Well, I'd say around maybe 11 or 12.
11 or 12. And how many hours do you say again?
Probably like 6.
6 hours. Is it all the way through the night, or do you wake up?
I'll wake up sometimes.
Okay. Um, do you feel you sleep too much or not enough?
Not enough.
Okay. Is there anything right now that you believe that causes your anxiety?
Whenever I'm meeting new people or like have something that I really feel like is gonna go wrong, but it's not always like that.
Okay. Has your anxiety been noticeable to other people?
Well, my parents, and that's about it.
Okay. I'm going to ask you this question. It's a questionnaire. It's called the Generalized Anxiety Disorder 7. And it kind of just lets me know where you're at. So, question 1. Feeling nervous, anxious, or on edge. Is it several days, more than half days, or nearly every day?
I'd say some days and some days not.
Some days. Let me grab the pen real quick. Sorry. So just some days. Not being able to stop or control worrying.
It depends on how bad it is.
Would you say it's several days of the week or more than half the days? Or nearly every day?
I'd say like several days of the week.
Several days of the week. Okay. Worrying too much about different things.
I'd say it's like every day.
Every day. Trouble relaxing.
Every day.
Being so restless that it's hard to sit still.
It's every day.
Becoming annoyed or irritated.
Like half the days.
Feeling afraid as if something awful might happen.
I'd say like the half the days.
Huh? So, any of these issues with anxiety, did it interfere with how you did your work at school or how you do things at home?
I'd say it can, but not always. It just
Okay.
I should really just go through it.
So somewhat difficult.
Yeah.
Okay. Let me just do a little calculation real quick. So. All right. Thank you for doing that for me. And I'll go over that with you in just a minute, okay? So how's your appetite?
I'd say it's pretty good.
You eat average, too much, or too little?
I'd say it can be anything. I'll eat too much or too little, but it's not really by choice. It's just by just things happen. I don't really know. I just realize it.
Are you allergic to anything?
No.
Okay. Have you ever been prescribed any medications?
Yeah.
Which medications?
I don't know.
Do you remember what it was for?
Anxiety.
It was for anxiety. Did you see a therapist for that?
No. Well, I don't know.
Was it a doctor?
Yeah.
Okay. And you don't remember the name of it? Are you currently taking that medication?
No.
Why did you not take the medication?
Because I don't like taking medicine that much.
Why don't you like taking medication?
It gives me that feeling of I'm on something, or I have to take something, so it makes me feel like I just am different, or that makes me really think about my anxiety and stuff.
Okay. Have you ever been admitted to the hospital?
No.
Any past mental health disorders that you've been diagnosed with?
I don't think so, no.
Okay. Any medical conditions? Have you ever been diagnosed with anything medical?
What is that mean?
Like any problems with your eyes, your heart, your lungs?
I don't think so, no.
Okay. Have you ever had a head trauma?
No.
No? All right. Have you ever experienced any life traumas?
I don't know.
What do you mean? Traumas can affect people in different ways. So, it may be something little to you, but it could be big. You know what I mean? So, is there anything that really, really upsets you?
My dog's dying.
Okay, so you're a passionate pet owner, huh?
Yeah.
All right. So, here's gonna be a kind of a hard question, but going through your family history, looking at your siblings, your mother, your father, and your grandparents, can you think of any that anyone in there that had a mental disorder or a medical condition?
I can think of my grandma that had all dementia, and I can think of my brother who had heart problems and like schizophrenia type, and he also had dyslexia.
Mm-hmm.
And then my great grandfather and stuff was on like drugs or have abused drugs.
Okay. Was there anybody else in the family that abused drugs?
I'd say that probably, but like maybe my brothers, but or one of my brothers that had heart problems, but I'm not sure if he still does.
Okay. So you talk a lot about that brother. How does that make you feel?
I don't know. We're not as connected anymore, and I don't know what's going on with him.
Yeah. So that kind of bothers you sometimes, huh?
I guess so.
Okay. Have you ever done any illegal drugs like marijuana, cocaine, methamphetamines, anything like that?
Yeah,
Yes.
but I wouldn't say anything linked to it.
Okay. What is the last thing that you used?
Marijuana.
And how many times have you used smoked? I'm assuming. How many times have you smoked marijuana?
I don't know. Not a lot.
When's the last time you smoked?
A while. Yeah.
Like a couple months, a couple weeks?
Couple of months.
Okay. And why did you smoke marijuana? How did that make you feel?
It didn't really make me feel like anything. It was just with my friends.
Okay. So you feel like it may have been a peer thing? Like,
yeah.
Okay. Have you ever drank, do you drink alcohol?
Yes. I've drank alcohol before.
Okay. Was it like just in an occasion or just with your friends again? Or
at parties and with my friends. Yeah.
About how much do you drink at those parties?
I don't know.
Would you say a cup of alcohol, a beer?
No.
Okay. And how does that make you feel when you drink?
Like I'm with my friends.
Okay. Do you drink caffeine?
Yeah.
Okay. About how many would you drink as far as caffeine?
Dr. Peppers and stuff.
Okay. About how many Dr. Peppers a day do you drink?
Probably like 2 or 3.
2 or 3. Okay. Do you smoke or vape?
No.
Okay. Do you take any medications for anything else, like over the counter, like vitamins or Advil or Tylenol?
No.
No. Okay. And what grade are you in?
10th.
10th. And which high school do you attend?
Bar.
Okay. How are you doing in school?
I'm doing alright.
What do you mean all right? Is you're making good grades or?
A little better than I was than what I was doing before, because.
So let's talk about that. Your aunt told me that you recently moved schools. Are you still with me, Grant?
Yes.
Are you nervous? Okay. So you recently moved schools. Which school were you attending?
St. Louis.
Okay, and so why did you decide to leave?
Because my friend got in trouble and moved schools, and I don't really like the people that are around there, and I have more friends at Barb, so I moved to Barb.
Okay. So you would say the biggest reason that you moved schools was it due to your anxiety or was it due to your friend?
Kind of both.
Both. Okay. Are you able to concentrate in class?
Yeah, a little bit. Yeah.
Good. Have you ever? These are just going to be some questions, but I want to ask you. Have you ever had any legal issues, like with the police?
I don't think so.
No. Okay. So, what would you say your current stressors are?
School, Going to school.
Going to school. Okay. What would you say your strengths are?
From like having friendships and knowing people.
Okay. Do you have a good support system at home?
Yeah.
And with your friends, obviously. So you said you were depressed lately, right?
Yeah.
Like, is it half the day or is it all day that you feel depressed?
I can be just off and on.
Okay. Have you ever been like really like energized and it's out of control lately?
Yeah.
Yeah? Okay, so how long do those periods of energy happen?
That can be from like an hour or two, and then like you'll just die home.
Okay. What do you think about when you're sad or angry?
I try to calm myself down.
Okay. Is it something you do physically to calm yourself down or mentally?
Mentally.
Mentally? Okay. So, do you ever see, hear, smell, taste, or feel things that are not really there, such as like voices or visions?
Not unless I stay up like 2 nights in a row.
Okay, so you have gone 2 days without sleeping before?
Yeah.
Okay, how often does that happen?
Not very often, but when it does, I mean, I'm pretty sure it's normal, but you'll start seeing things or hearing things.
Okay, so just when you're tired, it's not all the time.
Yeah.
Do you ever think about hurting others or getting even with people who have done something bad to you?
No.
Okay. Do you ever feel that life isn't worth living?
Oh.
Have you ever thought about doing away with yourself or?
No.
No. What do you think is causing your problems?
The stressors at school or just school in general. Just getting there.
Okay, so like during the summer when you don't have school, how do you feel? Are you more relaxed?
I'm more relaxed because of the freedom I have and the more options I have on what I can do.
Okay. So do you think that these moods and, anxious things are normal or abnormal?
I'd say abnormal.
Abnormal. Okay. So there's some things that we can do to kind of, I know you don't like to take medications, but we can talk about some education, like maybe journaling or yoga or exercising to kind of help with those anxiety times so you can work those things out instead of working it out in your head. Even just talking to me, coming in and talking to me or talking to your friend, those things can help with times of anxiety. Okay. So let's just try this. What would you do? What will you do when you're anxious, when the anxiety occurs? Let's say it happens at school, and all of a sudden you get anxious. What are you gonna do?
Just think that, I don't know.
It just kind of goes away on its own, but you don't like it, huh?
Yeah.
Okay. What did you eat for breakfast this morning?
Nothing.
Okay. What is your youngest childhood memory?
One that popped in my head the other day. Whenever we first got Rossi.
And Rossi is your...
One of my first dogs.
Okay. I'm going to ask you to remember 3 words, and in a few minutes I'm going to let you say them back to me. The words are blue, table, and horse. Okay. Who's the current president?
Joe Biden.
Okay. Okay, so similarity-wise, I'm going to say 2 words, and I want you to tell me what it kind of goes with. An apple and an orange.
What?
An apple and an orange. How are they similar?
They're both fruit, I think.
Okay. A chair and a table.
like living room furniture type stuff.
Very good. All right, so I really would like to start you on some medication, but I know that you're not really for it, so that you don't like to take the medication, so that kind of makes me worried to start you on anything. So I'm gonna see you back in probably a week, but I want you to go home, and when you go home, when you have these anxious feelings, I want you to write them down and what you're feeling at that time, okay? And then also, you can try some breathing exercises. I know y'all are very good at Googling things, how to do breathing exercises to relax you. Sometimes when you're at school and you can't talk to someone, that can help, okay? So I'll see you back in a week. And thank you for coming in to see me today. I really do appreciate it. Looks like you're really tired. Are you tired?
Yeah.
Okay. So I'll let you go get some rest, and again, I'll see you in a week. And thank you so much for coming to see me today. Okay.
All right.
All right. Bye, Grant.